You should have received an email from me this morning with instructions. First, click the Ready Talk link, enter your name, email address, and click Register, and you will be given access to the meeting. If you have any questions throughout the presentation, please type them in using the chat feature in the lower left-hand screen, and we will try to address your questions as they are asked. We will also open up the line for discussion at the end of the webinar and make sure all questions that were asked are addressed. Finally, the PowerPoint presentation and additional resource information will be sent out after the webinar today. And Janet, you're all set.
Thank you, and thank you all for having me here to speak with you over the internet today. I'm going to talk very briefly about some of the research we've been doing at the National Housing Conference on the intersection of housing and health. As most of you know, there is a connection, and you've probably seen it in your work, but it's always important to understand what those connections are and to really establish what kind of research supports some of these connections. So I'm going to start by going through some of the research that the National Housing Conference has collected that really helps establish these kinds of connections between affordable housing and health. And then I'm going to talk briefly about some of the new changes to the healthcare system that have created new opportunities for collaboration between the housing and healthcare sector, as well as new opportunities for funding. So let's start with some of the research. As I mentioned before, NHC has gathered research on the connection between affordable housing and health, and this research supports the premise that affordable and safe housing supports good health. And in our review of the literature, we have 10 different hypotheses that are supported fairly extensively by research. And I'm going to work through them just so we can spend some time thinking about what that connection between housing and health actually looks like, what kind of impact it has on affordable housing residents. And the first is that living in stable and affordable housing frees up household resources to spend on other things that are important for health, such as healthcare services, healthy food, and other items. Next, the research indicates that affordable and stable housing reduces stress for residents. And this is really important because excessive and chronic stress becomes very toxic for an individual's health and can negatively impact the health conditions of individuals. The research also indicates that affordable home ownership can positively impact mental health. It can help create stability and wealth building, which is positive for mental health. But we also see in the research that there is the other side, which is when people are living in homes that they own but cannot afford to keep, there are some real negative impacts to this. We saw households that were underwater or undergoing foreclosure suffered very severe negative mental health outcomes as a result. We also know from the evidence that well-constructed and maintained housing can reduce health issues or risks for housing-related illnesses that's connected to poor quality housing. So, for example, reducing incidents of lead poisoning or serious triggers for asthma attacks and other related illnesses. We also know that stable and affordable housing is an important platform for healthcare delivery to individuals. For example, storing and properly taking medication is very important for individuals with complex health needs. However, individuals who are homeless or unstably housed may not be able to properly store their medications or even access healthcare professionals to obtain their medications. We also know that it's not just the physical home that's important for health, but also where that home is located. So living in a home in a neighborhood of opportunity, which means you live in a place with access to amenities that support health and opportunity, is really important to sustaining good health because you can access necessary services not just for health, but other areas related to wellness, and this can have some real benefits for households. We also know that affordable housing can reduce the incidence of crowding. So if people can find housing they can afford, they're less likely to need to double up or triple up, which helps to reduce stressors, which is harmful to health, and also reduces exposure to disease amongst people who are living in tight quarters. Affordable housing is also really important to provide an escape for survivors of domestic abuse. Many individuals feel they are unable to leave abusive home situations when they cannot find housing they can afford. We also have evidence that green building strategies and location-efficient housing reduces monthly energy costs for households, which has the positive outcome of increasing their monthly resources they can spend on items that are important for well-being, and also reduces environmental pollution in their neighborhood, which is also good for their well-being. And finally, we know that connecting affordable and accessible housing with supportive services is really critical in helping older adults and other individuals with disabilities to live in their homes and their communities longer, which also supports better health outcomes. And now I want to switch gears a little bit. So now we've established that there's a really important connection between affordable housing and health. And that's considered by the health sector to be a social determinant of health, or some kind of outside factor on an individual's health outcomes. And this connection has been well understood for quite some time. However, there are new opportunities for actually seizing upon this connection to try and leverage housing or health to improve health outcomes. And the reason why this landscape is shifting is because of the passage of the 2010 Affordable Care Act and other associated health sector reforms. And so some of these changes are well outside the scope of what's relevant to housers. So I'm going to focus in a little bit on the areas that are relevant, since the Affordable Care Act is a huge piece of legislation. But the important thing to think about overall is that there's an overarching goal to the Affordable Care Act, and that's to improve health outcomes and also contain and reduce healthcare spending. And this legislation attempts to do that through many different levers, but the levers that are most relevant to housers consist of new authorities, new requirements, and new incentives. So I'm going to briefly walk through some of these changes so you can get an idea of what these new opportunities are. So one of the changes is the authorization of new healthcare organizations called accountable care organizations. These are entities that are very similar to managed care organizations. So these are organizations that are responsible for delivering healthcare services to Medicaid enrollees. And they consist of a network of healthcare providers or organizations. But they're a little bit different from managed care organizations in terms of their reimbursement structure from the Medicaid program. So these accountable care organizations are required to meet specified health quality and health outcome standards that are set by a state Medicaid agency. But what makes them different is, instead of being paid for each service that's provided to an enrollee, they're actually given an average monthly per member rate called a capitated payment rate for each member that they have. And if they spend more than that average rate, they're financially penalized and have to cover that cost themselves. If they spend less than that capitated rate, they're actually able to keep a portion of the savings. And so there's a very strong incentive for these organizations to reduce their spending while also meeting these health outcomes. And so this creates a strong motivation for these organizations to focus on the social determinants of health, like housing, the levers in which they can invest in order to avert serious illness and injury and reduce spending, and also achieve those better outcomes. And so this creates an opening for housing organizations to loop up with these ACOs to see what kind of partnerships you can implement, and also what kind of investment they would be willing to make in housing services for their members. One of the benefits is the savings that these ACOs are able to keep are flexible money that are not subject to strict Medicaid reimbursement rules. So there's a whole level of flexibility in how they invest their funds to achieve better health outcomes for their members. Another new entity is called a Medicaid Health Home. So these are similar to accountable care organizations and managed care organizations, in that they're health networks that are responsible for delivering health care services to eligible enrollees. And they're a little bit unique in that they are open only to Medicaid enrollees who have chronic conditions. So it's really trying to target some of the most vulnerable and highest need healthcare utilizers and focus on how to best address their needs, not in an isolated manner which has been approached traditionally, separating out physical health, behavioral health, and social needs, but really taking a coordinated care approach, which looks at the whole person's needs and looks at how all these services support their health outcomes. And so many states that have authorized Medicaid health homes have stipulations that require these organizations to focus on these social services that are provided to individuals. And so it really creates an opening for a healthcare entity to think about what is the role of housing in promoting the health of their members. What can they do to help individuals secure housing or find affordable housing or remain in their housing? And so again, this opens up a new area for housers and these health organizations to really work together. Another really important change is a recent federal rule change to the Medicaid program across states, which changes the kinds of practitioners who are eligible for Medicaid reimbursement. Until a few years ago, only medical practitioners could receive Medicaid reimbursement. However, with the rule change, the federal Medicaid agency allows non-medical practitioners to receive Medicaid reimbursement as long as they're offering preventative health services. And so states have discretion in how to determine who exactly is eligible for these preventative services reimbursements. But it creates a new opening. There are many services offered by housing providers or other healthy housing organizations that really focus on this preventative health lens and that may be eligible for reimbursement, which will really help stretch limited funds. As you all know, housing funds are limited, and trying to make programs survive on grants can be really challenging when trying to sustain a program over the long term. So receiving some Medicaid reimbursement can really help stretch those dollars and create a more sustainable model, particularly when you're looking at areas that are really important in Medicaid programs such as lead blood level testing and home investigations and asthma prevention. And so really looking at where there's already an overlap between what affordable housing organizations already provide and what might actually be eligible for reimbursement is really important. The next change that I want to talk about is the opening up of home and community-based services. So until recently, home and community-based services could only be offered when states added a waiver to their state Medicaid plan. So they would have to come up with very distinct, targeted, and narrow programs offering home and community-based services to Medicaid enrollees. And generally, they were restricted to small geographies. With the Affordable Care Act and other legislative changes, states can now offer these services statewide by adding a home and community-based service program to their Medicaid state plan. And so this really opens up opportunities for Medicaid enrollees to get services they need in their homes. Oftentimes, individuals who need some support and help to live at home can't access it or can't afford it, and therefore move to institutions like assisted living facilities or nursing homes in order to get the care they need when they'd rather stay at home. And so this really creates an opportunity for more individuals to age in place. The ACA also created a new program called Community First Choice, which can also be added to a Medicaid state plan, which allows for reimbursement for attendance services. So help with basic daily activities such as bathing and eating with a more person-centered approach, where the member gets to actually have a say in who they hire and what their own personal medical goals are. The next thing I want to talk about is a pretty exciting experiment currently only in New York State, but might really be a model for what other states can look at. And this is a new investment in supportive housing. So as part of New York State's Medicaid reform, they received a waiver to make significant changes to their Medicaid system, and one of those includes utilizing their state Medicaid savings to construct and rehabilitate supportive housing for formerly homeless individuals and older adults. And so this is really a new approach to thinking about using what's traditionally been considered as health funds for housing construction and rehab. It really makes the connection that a lot of practitioners know, which is that housing formerly homeless individuals has an enormous impact on improving their health and reducing the health care spending on them, also along with older adults. And so the state's going to be looking very closely at the outcomes of this investment, and it can really provide, I'm optimistic, some great evidence for really thinking more comprehensively about investing health money in housing and other social determinants of health. There's also a lot of work going on in states that's being led by the Corporation for Supportive Housing, or CSH, to look at ways in which the services that come as part of permanent supportive housing can be reimbursed by Medicaid. Many of the services that individuals in supportive housing receive are technically eligible if they are Medicaid enrollees, but it takes a paradigm shift to think about what these supportive housing providers need to do to become eligible for reimbursement and how to submit for reimbursement. And so really thinking about aligning these two sectors is a really important development, and thinking about breaking down the silo between housing and health, particularly in permanent supportive housing. And the last major change that I want to talk about is the hospital community benefit requirement. So this is actually a historic requirement that nonprofit hospitals demonstrate their benefit to their community in order to be eligible for their federal tax exemption. And in the past, it's mostly consisted of these hospitals providing free or reduced health care services. However, with the expansion of Medicaid eligibility in many states, the number of individuals who will need free and reduced cost health care services will decrease significantly. And so this opens up a new opportunity for these hospitals to think a little bit differently about how they provide this community benefit. For several years, in addition to providing free health care services, hospitals could also maintain their eligibility for a tax exemption by participating in what the IRS calls community building activities, so more comprehensive approaches to improving the health of their community. And some hospitals have really engaged in this process, but for most, there has been limited work in this area. So the Affordable Care Act really makes an effort to expand transparency in nonprofit hospital activities in this community benefit area. So instead of just tallying up the amount of free health care that they've given, nonprofit hospitals need to now actually create what are called community health needs assessments, and are required to engage community stakeholders in the process of looking at their community and determining what are the most critical health needs of the residents. And not only do they need to identify these critical health needs, but they also need to develop a strategy for how they, the hospital, are going to go about addressing these health needs in the community, and how they're going to be a part of really working to improve community health. And so this is a new opportunity for housing organizations and other community stakeholders to connect with their local hospitals and really talk about housing's role in promoting community health. Some hospitals who are engaged in this area have made investments in constructing affordable housing. Some have partnered with affordable housing providers to provide more extensive healthcare services and wellness activities on site in affordable housing developments. Other organizations have worked with nonprofit hospitals to think about the role of housing quality. And so this is still a new area that is developing, but really creates an opportunity for housers to approach hospitals and really get them to think about how their partnership or their resources can help address housing as a social determinant of health and really improve community-wide health. So that wraps up my comments, but if you'd like to read more about what the connections are between housing and health, you can read our report, The Impacts of Affordable Housing on Health, a Research Summary. And to learn more about these,
Sorry, go ahead.
I'm going to plug our last report. And to learn more about these new collaboration opportunities, you can also read our report, Affordable Housing's Place in Healthcare, Opportunities Created by the Affordable Care Act and Medicaid Reform.
Thanks, Janet, so much for this very interesting webinar. I'm going to open up all the lines for questions, and you can also submit a question in the chat box to the left of your screen. So
the conference has been unmuted.
The conference is unmuted now, so people can ask questions.
Version of the newsletter, and then I'll probably send out ours around November 1st or 2nd, like the first week of November is when
Does anyone have any questions?
Okay. And we'll feature the Family Fun Day. We'll feature
Do you
Halloween.
know if Pennsylvania has opted to take their Medicaid funding to use it towards the waiver program, or is
You know, I'm not familiar with the various waivers that Pennsylvania may have obtained. I did take a quick look before this webinar, and I do know that Pennsylvania has expanded Medicaid eligibility. I believe previously it was sought as a waiver under your previous governor, but your current governor actually adopted the Affordable Care Act definition of Medicaid eligibility.
Hi, I have a question. I'm calling in from Carlisle, Pennsylvania, related to the practitioners eligible for Medicaid reimbursement. Have supportive housing sites sometimes will have an in-home staff person that really handles emergencies and some of the socialization going on in those buildings. Are you aware of any move from any organization to secure Medicaid funding for like a resident night manager?
You know, I'm not aware of that. I think it really comes down to how the services offered by that particular employee align with what services are actually eligible for Medicaid reimbursement. I think typically in most states, and I'm not familiar with the details in Pennsylvania, I think Medicaid reimbursement is typically limited to physical and behavioral health services, and so I think it really comes down to how well those align. But I would recommend that you take a look at the website for CSH, the Corporation for Supportive Housing. They're doing a lot of work in this area right now with supportive housing providers and helping them to work with their state Medicaid agencies to do a better job of getting some of that Medicaid funding. And a lot of times I think this takes actually reaching out to your state Medicaid agency and working with them to not only find out what services are eligible for Medicaid reimbursement, but also letting them know if there's any gaps, if there are services they don't currently cover that are really critical and they should cover, or thinking about how to integrate the process to be a little bit more inclusive of supportive housing organizations.
Thank you.
Any more questions before we wrap up the webinar?
Yeah, I have one. Hello?
Okay. Hi, yep, go ahead.
Oh, hi. I often receive calls and referrals from healthcare providers or social workers whose clients need home repairs, and I'm wondering if there's any way of turning this back around when I get these requests now, turning it back around and saying, well, help find funding. Is there a suggestion of actually being able to wring some water loose of the Medicaid sponge here?
You know, that's a really great question, and I think at this point that's a really tough sell. There is a very firm line in the Medicaid program in terms of not paying for housing, except in very specific circumstances. And as far as I know, in states that also extends to home modification and home repair. And it's challenging because those things are also really important for health. So I think it's a tough sell in terms of thinking about wringing some Medicaid funds out for that. But I do think it's important, you bring up a really good point about working with healthcare providers to advocate for funds that help both organizations achieve their goals. I think what we've seen across the country is there's this very siloed approach to health being separate from housing. Even though healthcare providers and housers understand there's a connection, they're often working towards their goals separately. And so I think you can really gain more traction when you connect with the health sector and help them to understand some of your funding challenges, that you want to be able to provide home modification services, but the funding doesn't exist. But if you combine efforts, you can really help make a stronger case. This isn't just merely a housing issue, it's a health issue as well. I don't know that it would be easiest to get this from Medicaid, but perhaps you could get state or local funding for this.
Thank you.
Any more questions? Okay, thanks so much, everyone, for getting on this webinar, and thanks, Janet, so much for presenting today. And we hope that you join us in the future for future webinars. Thanks again, everybody.